Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
Right, it affects adults as well as kids, but kids are more vulnerable because their brains are still developing.
He's talking about the impact of social media on kids and teens. Earlier this year, the Surgeon General issued a new advisory about the effects it has on youth mental health. To be clear, social media isn't all bad. It can offer a lot of positives, but there are increasing signs social media can be harmful to the mental health and well-being of children and teens. Here's Dr. Mike Franz, Senior Medical Director of Behavioral Health for Regence.
The research is still fairly early, but some of it points without a doubt that social media does have an influence on our children's behavioral health, and that we need to start paying attention to that.
Recent research shows that adolescents who spend more than 3 hours per day on social media face double the risk of experiencing poor mental health outcomes like depression and anxiety. And here's the thing, nearly all young people use social media. According to the Surgeon General, up to 95% of young people ages 13 to 17 report using a social media platform. And more than a third say they use social media almost constantly.
These platforms are engineered to hook you, and they do have an effect at the neurosynapse. They increase dopamine.
Each child is unique and is affected by social media in different ways. For many, it can be positive. 58% of adolescents say that social media helps them feel more accepted. But on the flip side of that, there are problems, things like cyberbullying and unrealistic body image.
So we can only imagine what our adolescents are doing as they doom scroll and see literally thousands of images per hour that are unrealistic.
When asked about the impacts of social media on their body image, 46% of adolescents aged 13 through 17 said social media makes them feel worse. The Surgeon General calls for policymakers, tech companies, and researchers to do more to address the impact social media has on youth mental health. For parents, it really starts with opening up the conversation and listening to your child or teen.
So I don't want to paint this as all bad, but kids are still going to use it, right? So we need to be able to engage as parents developmentally appropriate our 11-year-old in a conversation versus our 17-year-old and everything in between.
Find more resources and information at kgw.com/healthiertogether.